Hello, my name is Brittany Thomas, and it's with pleasure that I present to you information and necessary information that I learned in regards to my disease topic, which was periodontal disease. Moving forward, I will refer to it as PD. When asked to select a disease topic, I went straight to my microbiology book, hoping something would stand out to me. And there it was, the teeth laying on the page, and I thought to myself, what better topic to talk about when I'm very passionate about my oral hygiene? It brings me great joy to know that we'll further discuss the pathogenic organisms, how it's isolated and cultured, the types of PD, how it's acquired, the risk and mechanisms by which the organism can cause disease, signs and symptoms, diagnosis and treatment, and then we'll conclude with prevention. PD is a serious gum disease, and it's basically an infection that can damage the soft tissue and without treatment can destroy the bones that withstand your teeth. It is a chronic bacterial infection, and some pathogens that causes PD are A. actinomyces communis, Fusobacterium nucleatum, Peptostreptococcus, and also Propheromonas gingivalis, which I will refer to as P. gingivalis. P. gingivalis being the main pathogen that causes PD, I chose to talk a little more about A. actinomyces communis, which is referred to as a tooth killer. It's a gram-negative anaerobe and is often found in association with localized PD. It grows well in environments of 5 to 10% of carbon dioxide, and its ideal temperature of growth is 37 degrees Celsius, and it does not grow at all in 22 degrees Celsius. Both selective and non-selective medium can be used for isolation. It is found in small proportions, and because its growth can inhibit in vitro by common oral streptococcal species and selective culture medium are useful tools in the detective of this bacterium. Along with the selective culture medium described for isolation, TSBV medium is basically the most widely used in the analysis of any kind of oral sample. So even people who avoid teeth decay can lose their teeth due to PD later in life. There are actually 6 types of PD, including gingivitis, PD itself, aggressive PD, chronic PD, systematic PD, and recurrentizing PD. I chose to talk about the most common two, gingivitis and PD itself, the ones that people oftentimes compare or get confused and think they're one and the same, as I did before. Gingivitis is a common and mild disease that causes redness and swelling around the base of your teeth, while PD is a serious gum disease that causes redness and swelling around the base of your teeth, damages the tissue that holds your teeth intact, and it can destroy the jawbone. It causes bad breath. It's painful when you eat. It has the ability for all of your teeth to fall out. It basically is like your mouth is rotting from the inside out. Gingivitis is the beginning of PD, and advanced PD is basically like the final stage in which you have no teeth at this point. And here's a few examples of gingivitis versus PD. When inquiring about PD, you'll have to take a few things into consideration: where it's found and how it's transmitted. We must understand that PD is initially by specific invasion oral pathogens that colonize dental plaque, the biofilms on the tooth surfaces. Basically, the host immune response to the inflammation plays a central role in disease pathogens. It is commonly found in the gums and the tissue, and basically the tissue that supports your teeth is where it's also found. It can be transmitted by kissing, sharing saliva, poor oral hygiene, coughing, or sneezing. Common facts regarding oral infection can be medicated through genetic or It can even be environmental factors such as plaque, bacterial, smoking, hormonal changes, and even diabetes, which triggers chronic release of inflammation mediators that results and basically the result is the inflammation affects the periodontal ligaments, the gingivae, the commensal, and the bone, like the jawbone, which is basically the cause of PD. It's by bacteria and plaque, and that is accumulated around the gum line, in between the teeth as well, and on the gums. Here are a few images regarding the stages of periodontal. As you can see, it's also not only in humans, it's also in pets as well. There's a few signs that must be, where there are signs, there must be symptoms. Some symptoms PD produces bad breath, of course, redness, swelling of the gums, loose teeth, and even basically sometimes your teeth can fall out. Once those symptoms are forefront and you're aware, the pain is starting to kick in by then. And you have to go to the doctor, of course, to get diagnosed. So you carry yourself to the doctor, and these are basically the steps in regards to what goes on when you get to the doctor. Once you're there, they go over your medical history and make sure there's no previous cases of PD and things of that nature. And then you'll move on to the x-ray, which is the next step. They basically do an x-ray of your teeth and see what's going on that way. And then the third step will be the dentist basically, just feeling around and see if you have any abscess or any, swelling or things that they may notice before they actually do the physical exam. And that's when they go in with the lightning and the tools and things of that nature to see if they can actually physically see. And then if there's additional tests and things moving forward, then of course you'll go through the additional tests. And they basically measure it by the space in between the gum line and the tooth. So that's how they're able to diagnose if you have PD or not. And some basic treatments for PD, you would of course have to go to the dentist, get a full medical cleaning, the cleaning of your tooth sockets, basically nutrients, brushing, making sure that you're flossing and things of that nature. And to basically prevent PD, of course, as I stated, you'll have to brush constantly, daily. Make sure you floss before and after each meal. An electric toothbrush, believe it or not, is said to be basically ideal to keep plaque buildup and to make sure that excessive food is not in between the teeth causing PD. And then visiting the dentist frequently is also ideal. Get your checkups constantly, so that, or I would say not constantly, but at least 2 times a year, at least once for sure, but definitely 2 times a year, to basically ensure that you don't have PD or there's no local gingivitis, and to assure that moving forward that your gums are healthy. So in conclusion, I hope that you've learned something new in regards to the pathogenic organism, how it's isolated and cultured, the types of PD, how it's acquired, the mechanism and risk by which the organism can cause disease, signs and symptoms, diagnosis, prevention. And before I let you go, I'll leave you with this little tip. Brush your teeth every day, and don't forget to floss, so you don't have to worry about dental loss in the future or now. Thanks for your time.